that to manage my illness medically, it has to be done pharmacologically and therapeutically. I don't understand all the big American words. I just don't. They said they have to start me on antibiotics right away. They told me they have to administer IV fluoroquinolone because MRSA is a potential organism in the hospital. But I'm not going to take that. It is my right. I don't have to take that medication. And in my culture, we don't take any medication that is more than 14 letters long. It's just too long. They said that I probably have to do just for 2 weeks. No, Jackie said I have to drink a lot of water. I have to go into this machine here that it doesn't even give me any money when I do it.
What is the incentive?
You rock.
I'm supposed to be taking antibiotics for my headache, for my fever, but I've been tossing and turning like a Caesar salad. I can't sleep.
You have a case of risk for disturbed sleep pattern related to chronic pain.
And I keep coughing, and so they give me nasal decongestant, they give me antitussive to help me to sleep. They also told me something very crazy. You guys will not believe this. They told me I have to stop smoking, drinking, eating junk food. What kind of life is that? That's not fun. I don't want to live that kind of life.
Can anybody see? This is a case of ineffective denial related to threat of unpleasant reality as evidenced by patient verbalizing that she cannot have fun without eating junk food and drinking.
I have to consult with my advanced practice nurse for the most important diagnosis.
The first one has to be acute pain related to inflammation of lung parenchyma as evidenced by patient report chest pain of 8 on a scale of 0 to 10. Can you give us some intervention for that?
Well, my interventions for my client were performing a comprehensive assessment of pain, including location, characteristics, duration, frequency, quality, intensity, and the precipitating factors of the pain, teaching her the use of non-pharmacological techniques such as relaxation, guided imagery, music therapy, and massage before, after, and if possible during painful activities. Also administering her pain relief medications to control her pain if it became severe. What do you think is the next most important diagnosis?
Has to be ineffective airway clearance related to excessive mucus secondary to pneumonia as evidenced by shortness of breath and thick sputum. Some intervention, please.
To obtain effective breathing, I monitored her respiratory and oxygenation status, positioned her to minimize her respiratory efforts by elevating the head of the bed, encouraged her to slow deep breathe and cough to release the mucus inside her lungs. I also encouraged her to use the incentive spirometer, 10 inspirations in 1 hour. I administered her medications such as bronchodilators as ordered. No further discussion, Your Honor.
Your Honor, I don't appreciate what they've been trying to do to try to get me out. They've thrown all these crazy medications at her. One, they threw an opioid, which is Vicodin. It was basically used for management for her pain. It binds to receptors of the central nervous system and alters the perception of this painful stimuli.
It gives me bad side. I don't like that. Actually, I like what it does to me, the side effects. It gets me dizzy, sedated, party, some more. But it causes the side effects of dizziness. I don't know about that one.
That medication causes you as risk for falls related to side effects of opiates.
Another medication that they gave her was an antibiotic called Pezerpen. It's a treatment for enterococcal infections, such as myself. And it basically binds to my bacterial cell wall, resulting in my death, which I truly don't appreciate.
I don't appreciate the fact that I can just go into seizure, the nausea, the vomiting, I can get super infection. I don't like that drug.
Yeah.
Why you give me that thing?
Another medication was Phyllocontin, which is a bronchodilator. It's used for increased diaphragmatic contractility, and it inhibits all this other stuff, which I can't even pronunciate sometimes.
I love you.
tried yet. Again, can you just give me Vicodin?
Another medication that they give the plaintiff is Tylenol, which is an antipyretic used for fevers, and it inhibits the synthesis of prostaglandins that may serve as mediators of pain and fever, primarily in the central nervous system.
Is this a Tylenol?
Yeah.
That one can give you kidney failure, but my kidney is African strong. I think I have it in my kidney. But Your Honor, I'm sorry, my sugar is a little bit low, so I'm just going to eat this chocolate.
Your Honor, is a risk for unstable blood glucose level related to lack of adherence to diabetes management as evidenced by patient eating candy bar.
Chocolate. I can't eat chocolate? Why can't I eat chocolate? No. I want to stay in my lungs. I'm not eating it.
Another medication is Nasonex, which is a corticosteroid. It's treatment of nasal symptoms of seasonal perennial allergic rhinitis. It's potent, locally acting, anti-inflammatory, and immune modifier.
This one, again, bad side effects. Dizziness, headache, chest pain, stomach pain, every pain. Why you treat me like this? No, you. Why you treat me like this?
And last but not least, the demon of all demons, Mucinex. It's cross-associated with viral upper respiratory tract infections. It reduces viscosity secretions by increasing respiratory tract fluid. Not my friend.
Yeah, that one make me cough you out.
No.
Yes.
Don't. No.
Yes. Don't drink that one. Yes.
Your Honor, both the patient and I feel we have done everything we can to get pneumonia, the defendant, out of her lungs. We feel that we have presented enough evidence to prove that pneumonia should be evicted. We rest our case.
Have all parties presented all the evidence so I can make my ruling?
No. Your Honor, I'd like to call a witness to the stand. That witness, can you please come? Yeah, homie. Your Honor, the attorney representing the plaintiff is assisting her in having me evicted when she herself has invited others to my pool party. With your permission, I'd like to go ahead and present Exhibit C.
Put the screen
Yeah,
on.
I know. I'm sorry.
Sonny said, I know.
You guys are little enthused to watch these videos.
Merciless.
Gentlemen of the courtroom, I would like your opinion if you all agree that this is a conflict of interest on the nurse's behalf for representing the plaintiff. I rest my case.
In light of the last evidence presented, I rule in favor of the defendant.